Okay, my friend. Now I want to share with our friends, with our patients, how is the postoperative period after the operation. So it has been 1 week after your operation. Yeah, we have both-sided, two-sided varicocele and hydrocele in the right side. There is very little hydrocele in the left. I also cure it, but it's not a problem. The main hydrocele was in the right side, and we have right-sided varicocele and left-sided varicocele. So you come here from Somalia, and tell me how is the recovery period? Is it difficult? Is it painful? And what happened in the postoperative period, please?
Yeah, I had for almost 7 days.
7 days, yes.
To recover from,
Normally we send some of our patients to their home after 3 days. Is it possible? Is it possible to go to home after 3 days? How do you feel?
Yeah, it was possible, but I decided to stay.
Yes.
So that I know my situation.
Because you had 3 operations.
Yes, I had 3 operations.
Yeah. And
that is why I stayed.
Did you? And you had operation before from the right side.
From the left side.
Left side. You had the varicocele operation. Previous operation. So secondary operations are always tricky, always difficult, always more risky. But we get used to do such things. But how was this 7 day? Tell me please, how was it? Was it painful?
It was not painful, although I did for the last 2 days, I did walk, some little walks and some little sittings.
Yes, how many hours did you walk for
the last 2 days I was feeling some pain. Yeah. But now I'm very okay.
Yeah, okay. Yeah. So you called me yesterday and you said, I have some bleeding. I call you because you are here in Turkey. Yeah. It happens after the walk. You walk around 30 minutes or 1 hour?
Yeah, additional of 30 minutes.
Yeah, so 30 minutes. In total, if you add everything, it's 30 minutes. If you ask me, is it too much? No. People go to airport, going to airport and walking to airport make maybe 30 minutes and they do it after 3 days. But there was a little bleeding. So what I see in the wound cleaning, wound change, it's not a problem. The bleeding was only in the wound site, scar tissue. Yeah. It may happen after the walk. So if it happens to any other patient, what I recommend, don't panic, don't be scared. If you went back to your home, just open the dressings and clean with iodine and then put a new dressing. This is the new dressing. A simple wound dressing. It may be waterproof or it may be a normal dressing. What I do here, I just take them out, clean the bleedings, then I put new wound dressing. This is not a problem. It is the same as if you have a scratch here in your hand. Yeah. Clean it, make a dressing. It may bleed next day. You will change the dressing. It is the same. It doesn't have any special or difficult wound cleaning, wound management. It's simple. Just change and new dressing will be put. So, do you feel in yourself you are good, you are healthy, and what is your recommendation to go back? I mean, for my Somalian friends, I know there are a lot of friends, Somalian people in Turkey, so you can stay here longer. Some of the Somalian friends stay here for 1 month. Yeah. They have no problem. But many people from other countries, they are in hurry. They have to go back to work as soon as possible. What's your recommendation? What's the shortest period needed to stay here?
I think more than 5 days is enough for my friends who are coming from or traveling from other countries. Yeah. This is not a big deal. As long as the surgery operation is successful, yes. You can go back to your respective country and stay there, rest for a little bit, 1 week. Yeah. Then after that 1 week, maybe you can do some lighter jobs.
Yeah, like light jobs, simple jobs.
Sitting small time in your office or walking small period of time. Yeah. maybe not less than 1 hour.
So you are coming here from your hotel, and it is, where is it?
Yeah, I had some walks from the hotel to the pharmacy.
Yeah.
Although I did not get the tablets the prescriptions you need to write for me. So that take almost 10 minutes. So after that, I take my taxi. Then it drops me in front of the.
And I have to say, if the operation is first time, healing is easier. If the operation is a second time procedure, healing is more difficult. If it's a third time procedure, because most of my patients who are coming here, they are secondary cases. They are operated once. If it fails, they search internet and find me. So most of the cases are secondary, tertiary, quaternary operations.
Like my case,
like your case, of course. So, and if it is a very difficult, for example, if your last operation, the healing was very difficult, so think about it and say, okay, I have to stay 1 week. If you will have two-sided operations, maybe it will be 1 week. But a normal first operation, 3 days healing is enough. Okay, a little risky. Maybe in the way back to home, you may have some pain.
Maybe sometimes people are running from, when you travel from your home, your respective country, then came here, then you be operated for one side or maybe two sides. But you are running from maybe to see when you wanted to see your situation or the update of your situation. And you cannot come back. Take that risk of traveling from your home, looking for visas. You can stay for almost 1 month. 10 days.
Yes. So if of course the coming back is not easy. When you go to your country, it's not easy to come. But we operate really too much from abroad. We know how to deal with it. Even if this bleeding happened when you are in your country, I would manage it from WhatsApp video, from talks. I would say, take the iodine, clean the wound, and now put it again. But always to be safe, to be in the safe side, you have to spare here as long as possible. The days you have to spare here, maybe a little longer. Yes, and overall, do you think you are satisfied with the surgery? What's your recommendations to people?
Up to this level, I don't have any problem. I am satisfied with the surface you offered, the way you received me from when I came in, when I was coming from my country, homeland. So I didn't know where.
Is it first time for you in Turkey?
It was the first time. So I a little bit searched something. I had some friends who received me from the airport, and they take me to the hotel.
Do you have a lot of friends here in Istanbul that you know, or just a couple?
I had a couple of friends, maybe. So no problem up to this level in Istanbul.
And the future management is also important, because now we finished half of the job. We have to follow up, we have to take care. And I be in touch from WhatsApp videos, WhatsApp calls, and because we will give you some medications to make the healing quicker. We will give you supplements. You will use them after 1 month. 1 month you will not use no supplements. The tissues will heal. Then you will use some supplements to increase the healing, increase the sperm quality, sperm parameters. Then we will ask for a test after these supplements finish. Then we will look this test and we will follow you. So it's an ongoing process, but we manage it. We love to deal with it. We love to follow you. No problem. Thank you very much for coming, choosing us. It's really an honor that to help people from other countries. We believe we are all friends, we are all brothers, and we want to do the best to connect the worlds, connect the countries. Thank you for coming.
Thank you very much.